Kanshoho is a manual therapy and a novel muscle relaxation technique developed in 2007. Kanshoho is a muscle relaxation technique that can bring muscles to a state of almost complete tension-free condition. It is said that modern humans Homo sapiens emerged about 300,000 years ago, and a treatment method called kanshoho, which can relax muscles without invasiveness, was born. Kanshoho is characterized by its immediate effect in muscle relaxation, allowing for relaxation of a significant volume of muscles in just 10 minutes. During the process of achieving virtually zero muscle tension, we investigated the metabolic changes in the body after muscle relaxation in 2022. This was believed to be the first such study conducted worldwide in manual therapy. These are the results of the study: comprehensive analysis of blood metabolites following muscle relaxation therapy in 2022, which was publicly released on October 13, 2022. In this study, conducted on healthy men and women aged 20 to under 65 years, during each observation period, a test treatment kanshoho for 10 minutes or a control treatment non-kanshoho for 10 minutes was administered. Before treatment, 10 minutes after treatment, and 30 minutes after treatment, a comprehensive analysis of blood metabolites was carried out. This analysis involved a randomized, single-blind, crossover comparative trial, and blood metabolome dual scan analysis was performed. The purpose of this study was to elucidate what significant changes occur in the body's components through kanshoho, whose effects have already been demonstrated in past papers and research results. The exercise intensity during kanshoho treatment was approximately 2 mets. Blood samples were collected at 10 minutes before treatment, 10 minutes after treatment, and 30 minutes after treatment. Subsequently, a second blood sample was taken 30 minutes after the first one, and a third blood sample was collected 60 minutes after the first sample. The test treatment involved applying pressure with a force of 500 G and an area of 1 square centimeter, while the control treatment applied 200 G of force over an area of 2 square centimeters. Other than the variation in pressure and the pressed area size, there were no changes in the test conditions. The trial period was set with a 2-week interval between test and control treatments, and it is believed that the participants, who were unaware of kanshoho, could not distinguish between the two treatments. At 200 G of pressure with a 2 square centimeters pressed area, it was observed that the fingertips did not reach the muscles and stopped at the subcutaneous tissue. As for the results of this study, we conducted discussions regarding the items that showed significant differences in metabolome analysis. Regarding significance, items that showed significant differences between groups test treatment group and control treatment group were considered, excluding items where there was a significant difference due to variations in the control group's values from before treatment. Items where there was no significant difference between groups but a significant difference was observed in the test treatment group compared to before treatment, excluding items where there was a significant difference only at 10 minutes, and the significant difference disappeared at 30 minutes. The results can be listed as follows. Free beta-hydroxy-5-cholestanoic acid, 3 increased. This suggests increased cholesterol metabolism, potentially promoting the formation of cell membranes and synthesis of hormones that rely on cholesterol. This may lead to expectations of improved symptoms and reduced risks of atherosclerosis, myocardial infarction, and stroke. 5-beta-tetrahydrocortisol 1 decreased. This is a metabolite of the steroid hormone cortisol. Excessive cortisol secretion can influence blood pressure and fat deposition. A decrease in cortisol may indicate potential benefits such as stable blood pressure, prevention of fat deposition, stress reduction, inflammation control, and improved immune function. Expectations include reduced risks and symptoms of type 2 diabetes, obesity, cardiovascular diseases, and fatty liver. Acylcarnitine 13:1-3, acylcarnitine 17:0-2 increased. This suggests an accelerated carbohydrate and lipid metabolism within the body. Expectations include improved symptoms and reduced risks of cardiovascular diseases, stroke, kidney disease, obesity, type 2 diabetes, cardiovascular diseases, joint pain, etc., and fatty liver. Oraptine 1 increased. Increased levels of oraptine 1 are associated with reported effects such as antioxidant, anti-inflammatory, anti-cancer, and neuroprotective properties. Expectations include improvements in antioxidant activity, anti-inflammatory effects, anti-cancer properties, and risk reduction and symptom improvement in neurodegenerative diseases such as Alzheimer's and Parkinson's disease. Biliverdin decreased. A decrease in biliverdin suggests maintained antioxidant activity. This may lead to reduced cellular damage, alleviated inflammation, and enhanced immune function. Cis-aconitic acid decreased. Cis-aconitic acid is an intermediate metabolite in the citric acid cycle, suggesting activation of the citric acid cycle. Expectations include reduced fatigue, improved muscle performance, prevention of arteriosclerosis, and potential for cancer prevention. Dehydroandrosterone 3-sulfate 2 increased. It is a type of adrenal cortex hormone and a precursor to both male and female hormones. Expectations include increased production of sex hormones, improved stress resilience, enhanced antioxidant activity, reinforced immune response, and anti-inflammatory effects. Deoxycholic acid decreased. Deoxycholic acid is a type of secondary bile acid involved in the digestion and absorption of fat. Expectations include a reduced risk of conditions like obesity and arteriosclerosis. Gluconic acid decreased. Gluconic acid is an organic acid produced when glucose is oxidized. Improvement in carbohydrate metabolism potential for increased insulin sensitivity is expected. Homoarginine increased. It plays a crucial role in many physiological processes, including vasodilation and relaxation of smooth muscles. Expectations include lower blood pressure and improved kidney function. N1-acetylspermidine decreased. It is involved in cell proliferation, differentiation, and apoptosis cell death. Expectations include the regulation of cell proliferation and differentiation such as the suppression of cancer cell proliferation. N2-phenylacetylglutamine decreased. It is a metabolite produced by gut bacteria. Expectations include reduced stress on the liver and kidneys, improved brain function, enhanced ammonia metabolism, and improvement in inflammatory conditions. Pyrocatechol sulfate decreased. It is a metabolite of catechols and is involved in antioxidant activity and inflammatory responses. Expectations include improved liver function and the inhibition of liver disease progression. Ricinoleic acid, 3 decreased. A fatty acid derived from castor oil, it has been reported to have anti-inflammatory and antipyretic effects. Expectations include the alleviation of inflammation and regulation of intestinal motility. Serine increased. A type of amino acid, it is involved in protein structure, neurotransmitters, and intracellular signal transduction. Expectations include improved neurological function, enhanced immune function, and liver function improvement. Taurolithicolic acid 3-sulfate decreased. It induces the production of inflammatory cytokines and triggers inflammatory responses. Expectations include the relief of inflammation. Trilaurin 4 decreased. Trilaurin 4 is a medium-chain triglyceride composed of lauric acid and glycerol. Expectations include a reduction in body fat. Beta-estradiol 117-alpha-estradiol decreased. When estrogen levels are high, the pain threshold decreases, pain becomes more easily felt. Expectations include the suppression of pain transmission. While the effects have been evident in previous studies and research, this blood metabolome dual scan analysis has also shown significant changes in values related to pain reduction and lipid breakdown. Kanshoho is characterized by its ability to relax muscles without invasiveness and without causing muscle damage, allowing muscles to reach a state of extreme relaxation. Remarkable changes occur within the body in just 10 minutes. We strongly encourage the adoption of kanshoho in the medical field to collectively help alleviate the suffering of patients, whether from pain or illness.